Timer. So, hey, how are you?
I'm fine, thank you.
Yeah? So we saw each other 2 days ago.
Yeah.
Did something else occur? Did you still have...
No, just the normal problems, nothing new.
Yeah, nothing new, okay.
Yeah, nothing worse, nothing better.
Okay, so we're gonna work on that. So today we're gonna talk about the treatment plan.
Mm-hmm.
First, what do you expect from me for the treatment plan?
Not really a lot, more like tips, guidelines, things that I can do to change.
Okay.
And because, probably I do something wrong. If there was no accident or anything, so it should be in like my posture or something like that, I think.
Yes, we noticed that already 2 days ago, that your posture, that you were sitting a bit slouched forward.
Mm-hmm.
So we're gonna work on that.
Right.
So think about sitting straight. We're gonna work on that. Do you still have some questions what we did earlier, or did you do some research or heard something that you have new questions, or?
Just that a lot of people were talking about massage. That they say that it helps, but to be honest, I don't really like massages too much. A bit too intimate, I think.
Mm-hmm.
I don't know.
No, I can.
Privacy.
Yeah, too personal that somebody touches
personal.
you.
That's better.
Okay. Yeah, I understand that, but honestly, what I saw or what I was thinking about for treatment plan, massage is not into it, because massage has not a long-term effect. So that means that it has effect right away, but some days afterward it will come back. Okay.
Okay.
So we're gonna work. If you agree with that, we're gonna work on a more long-term treatment plan.
Sure.
So in total, because as a physio you work with guidelines, so there's actually a guideline about non-specific lower back pain, and that indicates that with you we're gonna plan three treatment sessions, if you agree with that.
Okay.
So I was thinking about doing one session for 1 week, so you have a whole week with some exercises that will give to you some advice, like you ask, instructions. So I don't know if you agree until now. It's not a lot, but
it seems fine.
Seems fine.
Yep.
Okay, so what I was thinking about is I want to give you some exercises for the lower back in order to train the stability. So those exercises you could do them as much as you can during the day. But when you feel getting tired, you stop there for that day. Okay? But you can do them every day till the next session.
Okay.
Then we're gonna train strength and endurance.
Mm-hmm.
And those you will do them every 2 days. So you start today, I will show them, we will do the session together. Then tomorrow you won't, but you will do the stability, and then the day after you will do the strength endurance.
Okay.
Okay?
Yes.
So the exercises will allow you to develop the muscles in your lower back.
Mm-hmm.
So I hope, or I think, they can help you with your posture.
Okay.
So if you have more endurance and strength and stability, all those three movement skills, the fundamental movement skills, you will have a better posture for the rest. Okay. So it's really important to do those exercises at home in order to complete other tasks.
That seems logical.
Yeah. Do you agree with the fact that you have some homework exercises?
Yeah, of course.
Yeah?
Yeah.
Okay, of course I will explain the exercises afterwards. I will give you the parameters and everything, so you can do that at home.
Okay.
Second of all, what we can do and what we would do is what they call advising and instructing. So just as you asked before that you want to have some feedback from me.
Mm-hmm.
So I will give you a task. It can sound really odd, but I want you to think about some stresses in your life that occurs like every day, every week. What you feel, what you think that can imply that you have lower back pain.
Okay.
Okay. I want you to write down that on a paper and class them in the order of the biggest stressor to the lowest. Okay?
Okay.
So that will help you to work on your mental part. Can you think maybe why that could help, or?
yeah, like yeah, I know a few researchers that imply that mental state affects also the body. So I guess that.
Okay, yeah. And would you agree with that, to share that with me and to work on that, and then I can give you feedback, because actually that's true. The stress is one of the main causes of lower back pain.
Okay.
And especially if they are long-term stressors, they come back. So the lower back pain will come back. So what I hope to do with this is to prevent it to come back.
Okay.
So if you're aware with what's going on, then we could change that.
Okay. Seems fine.
Okay. So also you said, like during the examination, that you had problems with riding your motorcycle.
Yeah.
So that was quite hard to measure for me in the practice. So you also said that you had problems with standing up after a long time sitting, especially with this movement. Correct me if I'm wrong.
That's right.
So that was the same movement that you are constantly in while during riding the motorcycle.
Yeah.
So we're gonna work on that too. So I will teach you like transfers. We call it transfers. That are little steps that you have to do in order to stand up in a proper way, so that you don't hurt your back as you do now. Okay. Okay. Is that good? So in total we have 3 weeks. So each session each week, and we will have sub-targets. So we will the difficulty will increase each time that we meet. That's the goals that we want to achieve to go to the final target, and I was riding your motorcycle again to your work.
Yeah.
So do you have any questions?
Not really. It seems perfectly clear.
Yeah. So do you know what you have to do from now on, or after this session?
After this, I have to think about possible stressors in my life that can affect my back pain. And also some exercises, stability, which I have to do every day, and just until I'm tired, and the strength and endurance every other day, and with the, what's it called again, the
parameters?
Yeah, parameters for which you will explain later.
Yeah, of course, yeah. So then I have just one last question, or one last thing that you have to think about. As a physio, we work with articles on clinical expertise and what you expect from us. So you already said that you want a lot of feedback, so in order to improve that. But I found an article about riding a motorcycle. It seems to appear that police officers that ride a motorcycle often have a lot of problems with the lower back.
Okay.
So I know you love to motorcycle a lot. So I want you to think, if it's possible, like a sort of solution to diminishing it, or maybe sometime alternate between the car and the motorcycle. I don't know if you're open for that eventually to. If
it helps, yeah, of course. Like, it's not that I want to live with pain because I want to cycle all the time. So.
Okay, so that will be perfect. So we will talk about that in order with your stressors to find a perfect thing to go together.
Yeah.
So thank you, and now I will show you the exercises.
That's fine. Thank you.
Okay, thank you.